Hey guys, this is Mark Nejma from Newsweed.com. I finally made it home back to Tampa. Slept all day yesterday and feel so much better. Hope to go for a long bike ride today, but let me fill you in on some of my notes. I'm going through everything methodically, trying to bring you up to speed on what I saw. I'm so sorry that none of you could join me. I hope the next meeting you will attempt to go to Ireland or wherever else you might own stock, because stockholders meetings are very important. So let's kind of review what I felt was important in the last video. We're talking about ITRM stock. Again, I don't give financial advice. I'm just a guy who invests some of his money. I'm a roofer by trade, although I haven't roofed in probably a year. No, I can't say that. I was actually on a roof a couple weeks ago. And I'm taking my life knowledge and trying to share it with you. I need you to help me to figure out exactly what is going on. So let's start remembering what we talked about last time. The CFO said, I believe that the shares that we sold, I think we is the optimum word here. That means she and other people sold as well. A little bit about the CFO. She's a Catholic. I know she has a son. Went to Notre Dame Prep or goes to Notre Dame Prep. I think she's a very serious Catholic as well. So the chance of her lying are probably on the low side. Obviously, she's very successful. I did find some ties between her and the other participants on the board, which I'll cover in another video. FYI, when I left the meeting, I did buy another 5,000 shares right after the meeting ended. I now have over 500,000 shares. I have not sold any as of right now, but I'm trying to figure out exactly what I saw out at the stockholders meeting as well. Part of me, looking down at the notes, I believe, you guys know I took a lot of notes immediately after the meeting, trying to get the facts straight. So the second thing I'd like to bring up is Mr. Fishman said that he had a very different opinion of the lack of transparency. Okay, so he actually believes that he's being as transparent with us as possible. So it's our job to do more digging and try to find out exactly what's happening. I did tell him, why you're not buying shares of the company at such a low price. He came back and said, we all own shares. Again, optimum word, we all own shares. The team can go anywhere they want, but he doesn't feel like anyone is overcompensated, including himself. I asked him, how can you value your work? What is the value of your work? Why did you get paid so much money? He came back and he answered this way. He said, oftentimes you don't make it into market. And right now, let me back up. I said, what is the value of your work? You've been compensated heavily. You made a mistake with the submission to the FDA, and you haven't produced any revenue. That to me, means you should not be paid so much money. He came back and said, oftentimes you don't make money, or you don't even make it to market. Or if you do make it to market, it takes a number of years in a development stage company. And then he said, the company, we have never said, nor do we intend to, that we would immediately generate revenue. Okay, perhaps I was naive in asking that question. I implied you have to realize the type of, he implied you have to realize the type of company you're invested in. You as an investor should look at the type of company and what type of expectation you want from the company. I guess he's trying to say, like, these companies are like the farm league for the pros. They develop drugs for the bigger companies to then come in and take them out. I hope that's what it means. So the risk is in this little company to develop sulopenem, and that'll be brought to market or not. Anyway, he says there are many companies that do not generate profits rather. That's us. That's what he said. But, and then he came back and said, and he said that the company is working towards this product to bring it to market. And right now, they're working with the FDA to try to get alignment or approval and figure out what the company should do for their next trial. Meaning that they don't know what to do yet. It's taken, I think he said, 9 months to get to this point. He says hopefully we can ultimately get it approved and generate revenue. That's what he says. I asked him if he had a definite date from the FDA, and he said, we are working with the FDA. They've done whatever they can. They submitted information to the FDA, and they said that information was not sufficient for approval. The past 9 months, they've been trying to figure out exactly what the FDA wants. That was said in the meeting. Past 9 months trying to figure out exactly what the FDA wants. Fishman went on to say that they're in the late phase of that conversation with the FDA. As soon as ITRM knows that they are in alignment with the FDA, they will disclose that to stockholders. That's what I have so far, but there's more. And I will bring that to you tomorrow. The direction I'm going is evaluating every one of the board members, every one of the employees. I'm looking very deeply into this. I found some pretty exciting stuff. After the next couple of videos, I'll kind of go into that. What I want to do is try to figure out, do I buy, do I hold, or do I sell? From what I see right now, I'm holding because I have not made a definitive decision on the direction of this company. I appreciate all your time. If you haven't liked the video, I hate to be like these YouTubers, but follow me or something. All I can say is that I'm trying to make money in the stock market just like you are. I also like to invest in biotech because that's what cures people. I take about 10 different pills a day after my 3 heart attacks. I want to see biotechs succeed. I think the interesting part between Ireland and the U.S. is interesting because how much farmers are developed there. Appreciate it. Thanks. See you tomorrow. This is Mark Nejma from newsweed.com. See you soon.